America, we need to talk. It's a serious conversation, one that requires honesty and a willingness to confront some uncomfortable truths. On paper, you're the world's largest economy, a powerhouse of industry and innovation. Your financial markets drive global trends. A global superpower projecting influence across continents, a nation with unparalleled military might. The birthplace of jazz and the internet, a cultural and technological leader shaping the modern world. But when it comes to how long your people live, you're not number one, and that's a problem, a significant one, not even close. The reality is far more sobering than the image you project. In fact, you're not in the top 20, 30, or even 40, you're lagging behind many other developed nations. Americans are being outlived by people in countries you might not even recognize, nations with fewer resources and less global power. An American born today can expect to live about 77 years, a figure that should be a cause for national concern. In Japan, it's 84, a testament to their healthcare system and lifestyle. That's a 7-year gap, a lifetime in itself. An entire childhood or the lifespan of a hamster, plus time to mourn it. Think about what could be accomplished in those extra years. It wasn't always this way. There was a time when America was on par with the rest of the developed world. In the 1960s, American life expectancy matched other developed nations, a period of relative health equality. But since the 1980s, America started to fall behind, a decline that has continued for decades. While others kept climbing, investing in their citizens' health and well-being. Researchers call it the U.S. health disadvantage, a term that masks a harsh reality. A polite way of saying being born in America is a health risk, a statement that should shock the conscience. Despite spending more on healthcare per person than any other nation, a staggering amount of money, Americans are living shorter, sicker lives. The system is failing its people. The average American's healthy years now rival those in Blackpool, England, a comparison that is both surprising and concerning. A town known more for slot machines than longevity. A place where life expectancy isn't exactly a selling point. This isn't a blip or just about the pandemic. This is a long-term trend. It's a deep systemic rot that's been festering for decades. A problem that requires serious attention. It affects everyone, yet America seems unwilling to confront it. Why is that? Imagine a wealthy person eating nothing but gas station hot dogs day in and day out, then acting surprised by a heart attack. It's a predictable outcome. That's America, rich but unhealthy. A nation of contradictions. The paradox is glaring, a stark contrast between wealth and well-being. Why is the richest country letting its people die younger than their peers? What are the underlying causes? It's not just about money. Throwing money at the problem isn't the solution. It's about choices, systems, and priorities. It's about the values that shape society. The question is, will America finally face this crisis? Will it acknowledge the problem and take meaningful action? Or keep pretending everything's fine while the years slip away? The clock is ticking. Maybe you're thinking, that's just the average. It doesn't really reflect my situation. Perhaps you believe you're an exception to the rule, that statistics don't apply to you. I'm healthy, I'm wealthy, I'm fine. I've got access to the best resources, the finest healthcare. But the gap between rich and poor in America is staggering, a chasm that affects everyone, regardless of their position. The wealthiest live a decade longer than the poorest. This isn't just a matter of comfort, it's a matter of years, of life itself. Where you're born and your parents' income predict your lifespan more than your DNA. Your zip code can be a stronger indicator of your health outcomes than your genetic code. For the rich, America offers opportunity and cutting-edge medicine, the promise of longevity and well-being. For the poor, it's chronic stress, food deserts, and inaccessible health care, a daily struggle for survival. A child in a wealthy DC suburb might live into their 90s, enjoying a long and prosperous life. A child just miles away may not reach 60, their potential cut short by circumstances beyond their control. This isn't just about lifestyle, it's about the conditions of life itself, the very air you breathe, the water you drink, the food you eat. Even the rich are shortchanged. They may have access to the best resources, but they're still affected by the systemic issues. Wealthy Americans die younger than their wealthy peers in other countries. They're not getting the full return on their investment in health and well-being. There's an America tax on your life, no matter your income. A hidden cost that affects everyone, rich or poor. The system fails everyone, just in different ways. It's a complex web of interconnected problems that need to be addressed. The poor bear the brunt, facing the most immediate and devastating consequences. But even the rich lose years compared to their international counterparts, a stark reminder that no one is immune. It's like being on the Titanic, first class or steerage, everyone's on the same sinking ship. The rising tide of health inequality will eventually affect everyone. America's design produces worse health outcomes across the board. It's a systemic issue that requires a systemic solution. This should be a national scandal, not background noise. It demands our attention and our action. The question is, will anyone listen? Will we finally address this crisis and create a healthier future for all Americans? What's killing Americans so young? It's not just heart disease or cancer. The real surge is in deaths of despair, drug overdoses, alcohol-related disease, and suicide. These are conditions born of hopelessness, economic collapse, and social decay. They're hitting adults under 65, people in their prime, at unprecedented rates. The U.S. rate of premature death is about twice what you'd expect for a wealthy country. This isn't about old age, it's about parents dying before their kids graduate. It's a silent epidemic, especially in communities hollowed out by lost jobs and broken promises. First seen among white Americans without college degrees, it mirrors devastation that hit black communities decades earlier. When jobs vanish, so does hope, and deaths of despair follow. This isn't a problem medicine alone can fix, it's a social and economic sickness, and it's spreading. To understand America's life expectancy crisis, look at opioids. Drug overdoses are now the leading killer of Americans under 45. The engine? Prescription painkillers like OxyContin, pushed by Purdue Pharma and the Sackler family. In the late 1990s, Purdue told doctors OxyContin wasn't addictive. They funded bogus research and blitzed the market. Doctors prescribed it for everything. Profits soared. But OxyContin was highly addictive. When prescriptions dried up, people turned to heroin, then fentanyl, a synthetic opioid far deadlier. Fentanyl flooded the drug supply, often without users' knowledge, causing overdose deaths to skyrocket. Over 100,000 Americans died from overdoses in 2022. No other developed country allowed a pharmaceutical company to market opioids so aggressively. There's a glimmer of hope. Fentanyl deaths may be falling slightly, but the damage is done. The opioid crisis is a uniquely American tragedy born of greed and regulatory failure. The wreckage is everywhere, and the crisis isn't over. Opioids aren't the only threat. Alcohol and suicide are also rising fast. Deaths from excessive drinking jumped 29% between 2017 and 2021. It's not just liver disease. Alcohol fuels cancers, heart failure, and fatal accidents. The reasons? Stress, isolation, and economic anxiety trends worsened by the pandemic, but already underway. Suicide rates have climbed for 2 decades, now at their highest since World War II. It's a leading cause of death for young and middle-aged Americans, a sign of deep societal distress. America's mental health system is underfunded and inaccessible, while guns make suicide attempts far more likely to be fatal. Combine despair, broken mental health care, and easy access to firearms, and you get a perfect storm. These deaths are preventable, but the storm keeps growing, and it's costing lives every day. Beyond despair, a stark reality emerges. America stands out, unfortunately, for deaths stemming from both guns and cars. It's a distinction no nation should seek. These deaths are, in almost every instance, preventable tragedies. The U.S. has more guns than people, a statistic that's both astonishing and deeply concerning. Consequently, it also bears the burden of the highest firearm death rate among all wealthy nations. This is not merely a correlation, it's a crisis. And it's not just the horrific mass shootings that capture headlines, it's the relentless daily toll of suicides, homicides, and accidental deaths involving firearms. Then there's America's enduring and perhaps overly enthusiastic love affair with cars. The U.S. road death rate is shockingly and avoidably higher than that of any other comparably wealthy country. While Europe has actively redesigned its cities with pedestrian and cyclist safety in mind, America doubled down, building wide, fast roads and sprawling parking lots, prioritizing speed over safety. A staggering 70% of Americans choose to drive even for trips under a mile, whereas most Europeans opt to walk, bike, or utilize readily available public transit options. This pervasive car dependency isn't some accidental byproduct, it's a deliberate design choice, not an unforeseen accident. In 2022 alone, nearly 43,000 precious lives were lost on American roads. These aren't simply unavoidable accidents, acts of fate that couldn't be prevented. They're the direct and tragic result of specific policy decisions and priorities. Add up the staggering deaths attributed to drugs, alcohol-related incidents, suicide, a silent epidemic, the pervasive issue of guns, and the carnage on our roads caused by cars, and the overall picture becomes undeniably clear and deeply troubling. Americans are dying from preventable causes at rates that other wealthy, developed countries would simply never tolerate. This ongoing crisis isn't accidental. It's a direct consequence of deliberate design and policy choices. Now, the elephant in the room: healthcare. America spends nearly 18% of its GDP on healthcare, almost double other wealthy countries, yet outcomes are worse and life expectancy is lower. Why? The system is a chaotic patchwork: private insurance, employer plans, Medicare, Medicaid, and millions uninsured. Administrative costs eat up a quarter of spending. Money wasted on paperwork, not care. Navigating the system is a nightmare. A trip to the ER can mean financial ruin. Medical debt is the #1 cause of bankruptcy. Hospitals and insurers price in the risk of unpaid bills, driving costs even higher. The result? The world's most expensive, least effective system. It excels at high-tech interventions for the few, but fails at basics like prevention and chronic care. Millions avoid doctors due to cost. America's system is built for profit, not health, and it's killing people. Here's the most frustrating part. These problems are solvable. Researchers know what works. Other countries have shown the way. Want fewer gun deaths? Pass sensible laws? Fewer road deaths? Build safer streets? Fix healthcare? Simplify and ensure universal access. The solutions are proven, not mysterious. The real problem is political will. Special interests, pharma, guns, insurance, fight to keep the status quo. Their influence drowns out public health advocates and ordinary citizens. Even well-meaning efforts get misdirected, with funding and attention missing the biggest problems. The result? Inertia. Reports are published, experts wring their hands, but little changes. The problems are known, the solutions clear, but America remains stuck. The cost is measured in lives. So, here we are, a wealthy nation watching its life expectancy fall. The poor live a decade less than the rich, and even the rich die younger than their peers abroad. Preventable deaths from drugs, guns, and cars are rampant, all propped up by a costly, mediocre healthcare system. Why do Americans tolerate it? The crisis crept in slowly over decades, easy to ignore. The burden falls hardest on the marginalized, whose suffering is often invisible. Issues like gun control and healthcare are trapped in culture wars, while voters focus elsewhere. This is the America tax paid in years of life, not dollars. The gap with other countries is a massive opportunity closing. It would save hundreds of thousands of lives. Will Americans demand change or keep paying the price in time? Every day of inaction, the bill grows, and it's paid in the most precious currency we have: time.